Did you guys see this?
We're day 9, I think, with these cold sores, so just an update. I so badly find myself wanting to just pick at
Don't
them.
do that. There are definitely pharmacy approved ways to avoid your cold sores from lasting that long, so let's go through them together. So just a little background if you didn't know, cold sores are actually caused by herpes simplex virus type 1. The most important thing that you need to know is that timing matters more than any product. Of all treatments, antiviral treatment is going to work the best when it started early, ideally during what's called the prodrome, which is like that tingling, burning, or itching sensation that you get before a cold sore. And so antivirals are most effective when they're started within 24 hours of symptoms. The most common regimen that I see is valacyclovir, 2 grams, just twice in one day. Make sure it's 12 hours apart, so like morning and evening. Now, this is not going to cure anything, but it will shorten the healing time and reduce the severity of the cold sore. Then there's going to be like second line or add-on treatments, which are going to be more of your topical products. These I recommend, especially if you're having trouble seeing a provider to get a prescription for an antiviral. So the one that I will always recommend to patients over the counter is docosanol 10%, which is just the generic for Abreva. And this can really help when you start it early. So Abreva works by blocking the virus from entering the cells. Basically pretty much just locking the door so the virus can't get inside. So it shortens your healing time by about a day, and then for antivirals, it's about 2 days. But one important thing is that once it's blistered and fully scabbed, like you see in the video, it's probably too late to use an antiviral or a topical therapy. So then usually I recommend more supportive care, so like using like petrolatum on that area, because you want to keep the area moist and you do not want to pick at it. Because at this point, all we can do now is just wait until it goes away.